The issue of mental health in today's Ghana has become very worrying. For this reason, Mind Freedom Ghana, established in 2004, has decided to improve the mental health and lives of persons with mental health disabilities in Ghana, as well as promote their human rights and dignity in general. The NGO is envisioned to allow persons with mental health issues to have the right to treatment. Speaking to the General Secretary to the NGO, Mr. Dan Taylor says their 18 years of existence has been able to give huge visibility to issues pertaining to mental health compared to days before Mind Freedom was established.
Mind Freedom Ghana is an NGO. Our work has to do with issues of mental health and persons with mental health conditions in terms of their right to treatment and then their human rights in general. We envision that persons with mental health conditions will have the right to treatment, will have the space for them to be able to live in the society, not be left out but socially included in all aspects of the society so that they will not be stigmatized. I believe strongly that actually we'll be able to give this kind of huge visibility to issues of mental health. That wasn't like that in years past. In some time past, when you talk about mental health, people tend to associate those that they see on the streets. That is, but then there are people in our homes, in our communities who have mental health conditions, but we don't really know about. And according to the WHO, out of every 5 people, you have 1 person with a mental health condition. So we believe we are on the right course to actually be able to talk about issues of mental health for people to appreciate them.
Mind Freedom Ghana has established community support networks for persons with mental health conditions and their caregivers in regions like Ahafo, Ashanti region, Upper East and West, Eastern region, Greater Accra region and others to be able to congregate to come out with their needs. In spite of all the good deeds, Mind Freedom also encounters challenges in the course of delivering their services.
The challenges has to do with issues of human character and issues of finances. We are very much concerned about issues of character and perceptions, especially as to the way a good number of people in our country and even outside Ghana who perceive mental health conditions to be caused by spirits and the evil forces and all of that. I mean, when such cases occur, people are reluctant to go to the hospitals or the health centers. They rather will go to the prayer camps or the traditional centers for help. But with time, when they are not able to do anything to treat the person very well, the conditions aggravate, then they find their way to the hospital. So the issue of character and wrong perceptions is a major challenge, which we feel that people should really come to terms with mental health conditions. These are conditions that come about because of A, B, C. Some of them are hereditary. Some of them come about because of certain conditions or situations we fall in that can generate mental health conditions. On the issue of finances or funding, our work has to do with funding mainly from abroad. In terms of whatever proposal we write, either solicited or unsolicited, then we are able to get the money. We roll out. Much as we would have wished actually to do more than what we are doing. But the funds that we get at any given point in time is what determines what we can do. So these are the 2 major challenges I would dwell on.
The NGO Mind Freedom Ghana craves for the indulgence of the general public to desist from stigmatization and always be very much concerned, showing the right attitude to persons suffering mental health conditions. AB Safuwa Kentimpo, Flag 2 TV.